Fibroids are an extremely common problem in women. Over 50% or more of women at some point in their life may have fibroids. Fibroids are located either inside the uterus, in the muscle of the uterus, or outside the uterus. Depending on its location depends on the treatment option. If it's located inside the uterus, hysteroscopy is usually our treatment of choice. A telescope is put inside the cervix, and we remove the fibroid using either a scissors or a cutting current or a morcellator. To get to fibroids that are in the muscle layer or outside the muscle layer, we have to go from the outside in. Our choice is either laparoscopy or laparotomy. Laparotomy is like a C-section. A small incision is made in the bikini line, and we elevate the uterus and remove the fibroids one by one. A newer technique is laparoscopy with myomectomy. This is usually done with the robot. We go in with smaller holes, but several holes, and remove the fibroids out of the uterus using laparoscopic instruments, robotic instruments. How do we get those big fibroids out those little holes? We need to use a morcellator and chew up, like roto-rootering, those fibroids into little pieces. Presently, there are some issues with using the morcellator, and so this procedure is on hold until the FDA continues its review. Fibroids are removed, leaving the uterus behind, in procedures called myomectomy. That is done when a woman still wants to have more children. If fibroids are symptomatic and a woman is done having her kids, she might want to get that uterus out. It's giving her too much trouble. That's called a hysterectomy, when we remove the uterus. That can be done with a laparoscopy. It can be done with the laparoscopy using the robot, and it can be done using that laparotomy incision. These are 3 different ways to remove the uterus.